To give you a bit of a background of our medicine surgery course, and as mentioned, I've got Amina with me, who's a current student. Do you just want to say a quick hello, Amina?
Hi everyone, so I'm in my final year now and I'll just be adding some thoughts in as Lindsay presents.
Perfect, thank you. So I'm hoping that you're here because obviously you're thinking about studying medicine. That's very much the focus of today's session. The first thing to mention, it's not like other degree courses, and what that means in the sense of kind of some considerations when you come to studying it. Generally speaking, it's a longer duration. At Lancaster, we offer a 5-year course. We also have a 6-year gateway course, which I'll talk about in a second. It includes a lot of professional training. So whilst your standard course might be very kind of 3 years of study, this one, obviously, you have quite a few hospital placements, you get that work experience, you get that hands-on experience as well. So you kind of have that experiential learning as well as you go forward. And you're looking at a variety of skills. So it'll be kind of building up that knowledge, building up those clinical skills, but also those communication skills and that patient contact right from year 2, really, when you'll, for most courses, start going out and getting some of that actual hands-on experience. So yeah, the first thing to kind of think about in terms of studying medicine, it's quite a complex admissions process as well, and it's quite a competitive course. So just a few things to kind of have in mind when it comes to that starting point of applying for medicine. Most universities will also have an assessment process. At Lancaster, we currently have UCAT. There's quite a lot of competition for places, which is one of the reasons there's that additional step that's in place. Also, just to kind of see if you've got the correct skills for studying the medicine course and the reasoning for kind of doing so. And most courses as well will ask for an interview. So just a few kind of whistle-stop points. We will touch upon some of those throughout and some top tips, which I'll go to Amina for as well. But I just wanted to kind of flag, obviously, I'm sure you all know this already because you're obviously at the point where you're interested in it, but it is quite a competitive course, generally longer in length as well than some of our other courses. What we're going to look at today then are the medicine degree programmes that Lancaster offer themselves, the way that our structure, facilities and placements work, the academic requirements and the selection process, specifically at Lancaster. Worth noting that other universities will have different programmes slightly, they'll have different structures, different placements on offer and potentially different requirements as well. So if you're having a look, I'm sure you are at a number of different institutions, it is worth just double checking some of those factors as you go to make sure they meet things like your academic entry requirements, the subject requirements. And for example, the UCAT, is everyone asking for that, or other people asking for different ones? It's just worth kind of double checking all of that when it comes to that application process. And also the timeline, as I'm sure you know, the slightly earlier timeline of October generally when it comes for applications for medicine as well. So, as I mentioned, at Lancaster, we have our 2 programmes of study. The 5-year programme is the standard. We do also have our widening access route, which is a 6-year programme. That's specifically if you meet certain criteria. You can find more out about that on the website. I will touch upon that a little bit more as we go forward as well. I've mentioned the competitiveness, which again, I'm sure most of you know. At Lancaster, I would say roughly around 1 in 10 get a place. So that in terms of kind of competitiveness is what you'll be looking at in terms of having the right requirements, looking at the UCAT and that sort of thing. So in terms of that gateway year that I just mentioned, the aim of that programme is to attract a wider range of students to study medicine and increase diversity. It's for the standard course, you're looking at 3 A's or 2 A's and a B with the EPQ, which is to include any 2 of biology, chemistry and psychology. With the widening participation gateway programme, you need biology and chemistry at A level, and we'd ask for 3 B's instead of the 3 A's. So it's a slightly lower requirement. Essentially, you would start the course in year 1. It'd be very kind of biomedical in terms of some of the areas that you'll be studying. And the kind of aim of that is obviously to get you up to speed to then join the programme in full from your 2nd year. So that's just something that I wanted to mention if anyone is thinking about that kind of pathway programme there. We do offer contextual offers as well. They may be given a reduced offer as well for a 5-year course as well. So there's the gateway programme. There's also those students that might want to apply for the 5-year course that can receive a contextual offer. So just a couple of alternative routes that you can take for medicine. And just a note as well that that gateway year is very much designed to prepare students for further study in terms of developing knowledge, academic writing and independent study. This just gives you a bit more insight as well. It's generally 3 unit blocks of 5 modules, 15 in total, and you can see some of the different kind of subjects that you'll cover there to prepare you for that medicine course. So areas such as genetics, hormones, human physiology, for example. There's also a really bespoke tutorial system for that pathway. Progression is dependent on that good academic performance. Like I said, it's quite similar to biochemistry modules. There is potentially a possibility that you could switch onto a biochem or a biomed course if you pass it, but not to the right criteria to continue with medicine. So I just wanted to give you a whistle stop of that gateway course because that's the second programme. Most of this presentation, though, will focus on the 5-year course, which is what I would assume the vast majority of people will be applying for. So I thought this might be a good point, actually, Amina, just to bring you in for the first kind of instance, just to hear a little bit about your background, your application process, before we kind of move on to some of the more kind of specific things in terms of studying medicine. So take it away.
Yeah, so I actually didn't apply for medicine whilst I was in sixth form. I decided I wanted to take a gap year before just because I wasn't 100% sure if medicine was what I wanted to do. So instead of applying that year, I just sort of focused on my A levels and tried to get the required grades. So I did do the subjects required for medicine. I did biology, chemistry, and psychology. And when I got those grades, I think I'd also spent some time doing work experience that year as well. And that's when I applied for medicine. So it was after my results. But at that time, I think Lancaster was doing the BMAT exam, which is different to the UCAT now. So I prepared for the BMAT and the UCAT and applied to different medical schools. And that's when I got my offer and I was able to, I picked Lancaster as my first choice. And because I already had the grades, it was sort of an unconditional offer. But that was sort of my journey into medicine.
Great, thank you very much, Amina. So it just gives you kind of an idea of some of that process in terms of, as Amina said, we did used to do the BMAT. This is the first year, this last year, that we've moved over to the UCAT. And we'll talk a bit more about that a little bit later on. I might just ask you for some tips for preparing for BMAT. I know you did a slightly different one, but in terms of the preparation, it will be quite similar as well. So for the medicine course itself, we've got 125 places for home fee paying students, 4 places for overseas. So super competitive again, particularly for overseas students. That's partly based on things like NHS numbers and placements to make sure that we've got sufficient placements to go around for everybody. We also make a point really at Lancaster of having a relatively small cohort comparatively to some larger schools, just to really make sure that you do get that kind of one-on-one time really with the academics. You kind of can work in more small group discussions to support that problem-based learning, and to kind of give it a bit more of a community feel as well. So it is quite a supportive environment to develop students' potential and get you that early clinical experience, and that's another reason in terms of the cohort size that we limit it to. Problem-based learning is something that very much you'll start from the first year. Now at Lancaster, we have our Health Innovation Campus as part of our main campus. So it is a campus university, about 10 minutes via bus to the city. So you kind of get the best of both worlds. It is just one campus though. So you don't have a completely separate medicine campus, but you do have what we call the Health Innovation Campus as part of the main campus. It's just got its own area with really up-to-date kind of facilities, really up-to-date in terms of the ward simulation. And it very much, the aim of that is to prepare you for going onto your hospital placements right from the second year. So that problem-based learning is really about developing skills for lifelong learning through curiosity, kind of really putting some, almost trying to find solutions as you go, and supplemented with lectures, anatomy teaching. Amina, can I just bring you in here? I'm not going to play the video. I think instead it'd be just good to hear about your thoughts on how you experienced problem-based learning and what it actually was.
Yeah, so problem-based learning is basically how majority of our content is sort of covered in med school, in Lancaster anyway. So whilst you do have like some lectures on the side, depending on what rotation you're on or what sort of the focus of your module is at that time, you will have a few lectures, but the main way we learn is through group work. So it's about a group of 8 to 10 pupils, and you sort of just sit together, and each module lasts around 2 weeks. So you read the case in front of you with those students and with a mentor. So that would be like a professor or a teacher or someone. And then basically you analyze the case together, you come up with a few learning objectives. So what kind of things you think are important to learn about for your exams and just for practice and like clinical practice in general. And once you've sort of allocated those learning objectives for yourself, the mentor will sort of tell you like you're on the right lines or whatever, and then you go home and you get a few days to cover everything yourself and find out information through guidelines and recommended resources. So you're not sort of just left to your own devices. You do sort of have recommended textbooks and videos and things like that, and obviously the lectures to support your learning as well. And so you make your notes and you prepare for the next PBL session, and that's when you get together again and you sort of teach each other what you've learned. So maybe like one person will decide that they want to explain one learning objective that they've really enjoyed learning about, or they think they've got a good understanding of, and just sort of teaching each other is the way that you learn in PBL. And I think that's really, really useful, just because I think you get different perspectives and it's sort of group work. So it's really good to understand your content that way. And also you've also in first year you'll also have sort of anatomy teaching as well. So that'll be from an anatomy professor. So you do have a lot of support as well as independent learning. But one thing I really liked about PBL is I think I've noticed how much of a difference it's made in clinical practice over the years. So as my placements are becoming more and more thorough and I'm going to placement a lot more compared to university, I've realized that that style of learning actually comes into play when you're on placement and probably when you're a doctor as well. It just sort of gives you the skill set to read up on guidelines, and it gives you the independence to learn as well, which I think medicine it encourages a lot. So that's what I thought about PBL, and I really do think it was it was a teaching style that worked for me, because I know that some universities and some med schools do traditional lecture-based learning. And whilst that can be useful for most people, for some people, I do think PBL is something worth looking at. And if you think you're someone that works better in groups, then this is something that you should definitely consider.
Great, thank you. I'm not going to show the video for problem-based learning. There were a few videos within this presentation. I think these slides will be sent around afterwards. So if anyone's watching this thinking, actually, I'd like to find a little bit more in-depth information about that, there's some really valuable resources online. So they'll be shared within the links, I believe, that are going to be forwarded after. But I'm not going to play that just for the purpose of today to make sure I've got enough time to cover everything else. This is just a quick note on the curriculum review that's currently including feedback from students, alumni and clinicians. There may be some changes to the structure that might be coming kind of in the future. There's not really any kind of further update on that really. That's just kind of a note that there is that curriculum review ongoing. But what I really wanted to kind of talk about is that current structure, and most of these areas, regardless of any curriculum review, will still be what's going to be covered in terms of the course itself, so however that course looks like. It's very much going to be kind of intersecting teaching blocks that we currently do. You've got your kind of medical sciences, so that really focuses on the knowledge side of it that underpins that medical practice. We touched upon there kind of things like anatomy that Amina mentioned, also things like physiology, pathology, pharmacology, for example. You'll also look at health, culture and society, so some socio-economic, cultural, environmental factors, psychology of health, and that kind of feeds into it as well. Population health, and also professional practice, values and ethics. You'll look in terms of skills at both communication and clinical. So again, it really does kind of prepare you, obviously, for that actual communication side when it comes to the actual placements and that patient contact. It's kind of all the different pillars of learning that they kind of look at. So it's kind of a bit of a broader look at the kind of different skills you need in terms of studying medicine and what's going to prepare you for the workplace. They're the core kind of areas that they're going to be looking at when you study. And again, these ones that the kind of areas you're studying on there, other universities you may be looking at are probably quite similar in terms of some of the things you see. Lancaster as an accredited course, many universities do as well, and I'm sure they share a lot of those pillars of learning. Some of the modules may differ slightly. It's always worth having a look as well at things like the kind of different module options too, which you can find on various web pages. Lancaster has its own medical school website, and you can find in-depth information on the different modules and things on there. So anatomy teaching. Amina, I think I'll bring you back in here just to talk a little bit about that anatomage and the kind of different anatomy teaching and your experience of that, if that's okay.
Yeah, so like I said, your sessions will be based on the modules that you're doing in PBL at that time. So in first year, we sort of learn everything as normal. So we learn about the human body as normal. We don't really learn much about diseases in first year. So anatomy will go through each system in first year. So if you're doing a module on the heart, then you'll have an anatomy session on the heart. And I think what's really good about Lancaster's anatomy teaching skills is that they've got this anatomage table, which if you come to the open days, you'll be able to see for yourself. It's really sort of advanced technology which helps you to, we don't dissect real bodies in Lancaster, but it sort of gives you a digital body, and they're real patients that have donated their bodies for medicine, and you get to sort of dissect them. And the good thing about the tables is because they're sort of technology, you're able to like see label things which you wouldn't be able to do in real cadavers. So I think the anatomage tables are a huge asset to the anatomy teaching, and it makes it really useful because you can go in during exam season and book out the room and use the tables and dissect bodies and look at all the blood vessels. You can isolate things on their own and just have a look at different views. So that's how we do it. So essentially we just have, I think it's like a 2 hour session for every module, and you sit down with the professor and they sort of draw things and they go through the anatomy, but trying to make it relevant to the physiology of it, so how it works as well. And yeah, they'll bring in ultrasounds and imaging if it's relevant, and you get to sort of see your own kidneys and things like that. So it is quite useful.
Great, thanks, Mina. And as mentioned, we don't use dissection or prosection. It is very much a 21st century approach. So kind of those anatomage tables, very virtual, really kind of up to date in terms of those facilities. I will show you a little bit of this video actually, just to give you an idea of some of those facilities. So I'm just going to show you that. Just realised I was still on mute. That's just to showcase some of the anatomy teaching there. Hopefully visualise some of the images we've talked about, just to kind of give you a real feel for what the Health Innovation Centre looks like and what that anatomy teaching looks like. So on to communication skills, that's very much small group teaching. Principles of effective communication. We do things like the role play with simulated patients as well. And you can see there it's very much a reflection on real life experience and some of that video capture and constructive feedback. So is there anything you want to add, Amina, on those communication skills and how you find that kind of preparation process for going into hospital?
I think it's really useful because they do teach you how to take histories as well. So all the communication skills are very practical things that you need to know anyway for placement. But it just helps to know because it might be quite daunting to go into placement for the first time and see a patient. But with this, especially in first year, when you get all that experience talking to these patients and making mistakes in sort of a safe place, you can really build your confidence before placement starts. And I think that was the main strength of communication skills in year one.
Great, thank you. So I'm going to come on to clinical placements now, and this gives you a bit of insight into some of the places we work with. So you can see on this map, we've got Royal Lancaster Infirmary, which is the local trust. We also work with 4 others though. There's Finesse General Hospital, which is towards Cumbria. We've also got Royal Blackburn, Burnley General and Blackpool Victoria, all in the Lancashire region. They're all within an hour of Lancaster. But what it does is it really gives you an opportunity to do rotations at different trusts and get different experiences. So you're not always necessarily going to the same trust. It's kind of very much around getting you out and about and going to kind of see how different trusts operate. In year 1, you're learning small group sessions with a GP tutor as well about the fundamental principles of GP care and how care in the community is delivered. There are facilitated discussions as well on real patient consultations. So you really do get that preparation work for that placement. Before we move on to facilities, actually, Amina, I think I'll come back to you because I know we talked about how it's probably quite useful to get an understanding of maybe some of those placements that you've done. So it'd be really useful if you could share with us some of those placement opportunities.
Yeah, so over my time in med school, I've actually been to every single one of these hospitals, and I think the goal is to try and get you to as many as you can, just because each sort of area is made up of a different community and different demographics and things like that, and it's good experience to see what hospital work is like in different trusts because it's not going to be the same everywhere. So I think getting that wide range of experience is really useful anyway. But currently, right now, I'm in RLI, so Lancaster. I've just come from Blackburn, but it tends to change every rotation, or you could just be in one place for a few rotations. It is depending. I just think it's nice to get a fresh start on a unit rotation in a different hospital as well, and also get used to different sort of systems and how things work. But yeah.
Great, thank you. So in terms of facilities, I've talked about our Health Innovation Campus. You can just see the front of it there. We saw a little bit of this in that video as well, but we have there's the anatomage table again and just some of the different things we've got in terms of simulation wards. It was built in 2020, so it is all pretty new in terms of facilities, very well equipped with that kind of anatomy suite, the clinical skills practice, problem-based learning facilities as well. So that's just a bit of insight into the Health Innovation Campus. I always recommend as well, for those of you that are considering where to study, it's always worth going to have a look around the facilities just to kind of get a feel for it, to see if it's somewhere that resonates as somewhere you might want to study. So top tip, make sure you do kind of head out to as many universities as you can that are of interest to you, to really showcase for yourself those facilities. So in terms of clinical skills, there's a weekly teaching session in year 1 in a purpose-built lab, assessed by objective structured clinical exam, and then placements from years 2 to 5. We've just touched upon that, obviously, with Amina, some of those different blocks. Sometimes it might be a 15-week rotation in year 3. It might be kind of 5 different blocks. There's different kind of areas that you'll do in terms of the length of those as well. But that will really kind of build up some of those clinical skills. Another video here, which I'm not going to show you just due to time today, but if this is shared around after and you are more interested to learn some more about those clinical skills, I'd recommend giving that video a watch. I did want to move on to some of the selection process and those kind of top tips as well for those of you, because I'm sure they may be things that are of interest here. So we're going to touch upon some of that now. So what are we looking for? I think it's a good starting point. And I'm not going to kind of read through all those, but you can kind of see there it's very much well-rounded individuals. So when it comes to applying, there's obviously you'll be looking at those subjects that you're studying. Generally, it will be things like any two of biology, chemistry, or psychology. Some courses may ask just for biology and chemistry. So just kind of something to think about in terms of the subjects, the grades, obviously. But when it comes to the personal statement and potentially some of the questioning in the mini interviews, which we offer at Lancaster as well as the UCAT, it's very much really why you're passionate about studying the subject and any potential career goals you've got. All those sorts of things can kind of come into it that'll show that obviously you're more motivated and academically able. But also we want to kind of get a real understanding of what's brought you to kind of want to study medicine. And in addition to obviously the academic side of it and the motivation to do it, it's showing some of those communication skills in terms of that compassion and that resilience as well. So there's a whole different host of things that the admissions process looks at and what the university will look at in terms of you as an individual. And they're just a few of the areas that will be considered. Very much a four-stage selection process. So academic excellence, number one. The university clinical aptitude test, which we've touched upon, and many universities do ask for that. So that's just something obviously you'll do in terms of applying at the application stage. Multiple mini interviews, which currently at Lancaster are done online. And then your fitness to practice. So that's very much just around making sure that there's nothing in your background that would kind of contradict in terms of when it comes to that fitness to practice and making sure kind of everything's safeguarded and that sort of thing as well. We've touched briefly upon the A-levels, so I'm not going to go into too much depth on this, but this just gives you an idea. That's the grades that we require at Lancaster, so 3 years. We do accept EPQ, and if you get a B in your EPQ or a fourth AS or A level, then we will accept AAB with a B in that. GCSE, there are some points in terms of the scoring system. So again, I'm not going to focus too much on that right now, but you can probably quickly work out in your head if you meet those criteria. And just in terms of that scoring system, I just wanted to mention it. That will be different at different universities. So just make sure when you're looking at who to apply for, if there is any GCSE requirements, that you can meet them, because you don't want to waste a place on somewhere that perhaps you're not quite meeting one of those criteria for whatever reason. So just worth double checking what they're asking, both at A level and also at GCSE. We've touched briefly on contextual offers. This just gives you a bit of an idea about some of the criteria there. So you must be predicted at least 2 A's and a B and fully meet the GCSE requirements that we've just touched upon, and also meet 2 of the following criteria. So again, I'm not going to go into too much depth in that today, but if anyone was wondering what the contextual offer programme looked like, you can have a quick whiz through that and see potentially if you think you might meet that. Again, the aim of that programme is very much to increase the diversity in the medical profession and to recognise certain groups face additional barriers. So just to recap, this isn't for the Gateway programme. This is for a contextual offer for the main 5-year programme, where potentially you may be offered the chance to attend an ABB as opposed to 3 A's or 2 A's and a B with the EPQ. Just to recap again on that Gateway, that was 3 B's, so it is a slightly lower offer for the Gateway programme. We do accept other qualifications as well. It is worth, again, visiting the medicine website. I think the link's in the chat as well. You can find it on that slide too. But if you're thinking, well, actually, I'm not doing A-levels, I'm doing something else, will they accept that? Just double check on the website. If it doesn't list it, it's always worth dropping our UG admissions team an email, which is just ugadmissions@Lancaster. I can drop that in the chat after. But that's just kind of just if you're not sure if you will meet the criteria, you can find out through the website or through our team there. And this just touches upon the English language requirements as well. So again, I'm just going to leave that on the screen for a minute, but that kind of feeds into the GCSEs if that's what you studied. The Gateway year, it's very similar in terms of the 2 criteria that we've just showed for the contextual offer scheme. So again, that 6-year course, that's the 3 B's. You must meet 2 of those criteria to be considered for that programme as well. In terms of your entry requirements, it's slightly, mentioned the 3 B's, it is slightly lower in terms of that GCSE scoring system too. But biology and chemistry for that one are both required, so you don't have the psychology option with that. In terms of UCAT, and I think I've just seen there's some UCAT prep in the chat. This is kind of very much around verbal reasoning, decision making, quantitative reasoning, abstract reasoning, and situational judgment. That's kind of how the process is for it. You'll end up with a score. Most universities may have a cut-off that can tell you in advance. As I mentioned, it's quite new to Lancaster. What I would say, if it's anything like the BMAT, it would generally be, we'd look at the average of people for that year, and then anyone over a certain amount will get invited for the interviews. So that's kind of where it is utilised. I know you did BMAT, Amina, but do you want to kind of touch upon a little bit of your preparation? And I'm assuming it was quite similar as well in terms of some of the things that were being assessed here.
I did both. The UCAT was a little different, but the main principle is it's all about sort of time and how you manage your time in the exam, and all about how much you practice as well. So I think both in terms of preparation for both of them, yeah, it was a lot of just practice, 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 and it wasn't like new information. It wasn't things that you haven't already covered. So for example, in quantitative reasoning, it is basically maths. It's just about how you pick and manage your time in the question. So I think the main thing about preparing for entry exams is doing everything under time pressure, and practicing loads. So that's the only advice I have for entry exams.
Great, thank you. I think this has been shared anyway, but there is lots of resources out there to prepare. They are free resources. Do utilise it and just prepare, really. I think, like Amina said, if you kind of go in prepared, you've got a preparation plan you can utilise, you've got practice runs. It just means it's not there to trick you. It's very much just there to kind of, all the information is there that you're going to be assessed on. So just make sure you utilise that and prepare as much as possible. You can check dates of when you can do it. I know for this year, the tests were available from, I think, the 18th of June, and then the booking closed at midday on the 19th of September. So they were the kind of dates for this year. I would imagine it will be very similar dates in terms of 2025 as well. The medicine deadline is mid-October generally as well. So just make sure you, at some point between June and September, you are booking in and doing that UCAT. So admissions, test top tips, again, just repeating really what I've just said in terms of utilising those free resources online. Look out for any changes as well. Familiarise yourself with that format and just practice those sessions, practice them under time conditions, and just get yourself into a position where you're as confident as possible going into your UCAT. Again, it's not there to trip you up, so just utilise it as an opportunity to kind of showcase what you already know. So the next stage, multiple mini interviews, and again, lots of universities will do these. This is there to assess your motivation to study medicine. It's almost in some areas elaborating on your personal statement, your understanding of your career choice, looking at some of your skills, values and attitudes, and the communication skills too. These are currently done via Teams at Lancaster, so they are done online, they're not currently in person. Amina, again, I'm going to come back to you just to see if you've got any comments on the MMI stage.
I just want to say that I worked as an assessor on the MMIs as well now. So
Okay.
I've spent time like sort of interviewing potential candidates myself. And I think the main thing is it's really good. It might be quite daunting, but I actually think it's quite good to have a fresh start every time you start a new station. So the MMIs are sort of different questions with different interviewers and different stations. And I think that might sound scary, but in the long run, it actually makes a lot more sense that if you've maybe had a station that you weren't too happy with, you can sort of regather yourself and do a lot better on the next one because it's a whole new sort of interview. So I just think I think it's quite, I'd prefer this over panel interviews personally. But yeah, again, with this, it's all about how much you practice, practice with friends, family, things like that. And you will see again loads of really expensive courses online. You do not need to go to those. Like you can find a lot of information online and just keeping up to date with hot topics in the NHS right now. Your basic principles of ethics and things that come into medicine. So all this information can be found for free online. And if you know that and you've practiced your communication, then you should be fine.
Great, thank you. This just gives you an idea again. I think Marina's touched upon some of this anyway, but how it might look. So this is looking at a 15 station exercise, 5 minutes at each station plus a 20-minute group exercise. And it just gives you an idea of what that might kind of look like. So preparatory and assess stations, there'll be break stations as well, just to kind of give you that little breather. Very clearly defined criteria and multiple assessors and interviewers. So as Amina said, she's actually an assessor now herself. So lots of different opportunities as well to get involved there. But just gives you an idea of what that might look like on the day. This gives you a bit more insight into some examples. So it might be that you're asked to review some data, for example, of a graph or table or discuss it. There's the group work element. There might be about reading a statement about an ethical issue and discussing it. An interview just to really kind of get an understanding of your reasoning for wanting to go into that career choice. And again, just digging a bit deeper about why you're passionate about studying that subject, which is a big part of what the universities will be looking at as well. It also gives you a chance just to showcase the communication skills already existing, because obviously communication skills will form part of the course. So it gives you that chance to showcase any existing communication skills and interaction with the member of the public in that context as well. So just to give you a bit of insight into what the MMIs might look like. The next stage we touched upon is fitness to practice, so very much around kind of probity, health, criminal background. We talked about kind of the DBS and the safeguarding side as well. That just kind of gives you an idea of some things that will be looked at. It mentions there about disabilities and health conditions, just to emphasise having a disability doesn't stop you from becoming a doctor or medical student. It's just kind of making sure that you've got that fitness to practice as a whole. So the probity is very much around you being honest, truthful, acting with integrity, all the qualities really that a doctor needs to display. So that's kind of what that looks like in terms of your fitness to practice. Personal statement, you'll hopefully be able to demonstrate lots of things within there that tick this fitness to practice box as well. If for whatever reason you said something within your personal statement that turned out not to be true, as an example, that'd be an immediate black mark, because obviously a lot of this is about that kind of honesty and that ethical side of things. So again, I'm not going to play this video here. I just wanted to include it. This is a really useful video with some other students. If you found Amina, I found really, really helpful today in terms of the things you were bringing to the conversation. This kind of just gives a little bit more insight from a student perspective. So I will leave that there if people want to play that at a later date. The other thing I just wanted to mention as well, you'll generally get 5 choices. The 5th choice can't be medicine. So just have a think about that 5th choice. So the reason for that, obviously, it's a very competitive course. It's to give you a backup option if for whatever reason you aren't successful at the other 4 that potentially you apply for. So do have a think as that backup at other courses. At Lancaster, as I mentioned, we do things like biochemistry, biomedicine, biomedical science. We are just launching as well a pharmacology course. So there are alternatives out there, both at Lancaster and other institutions. Do think about what you might want that 5th choice to be as well. I also wanted to mention at Lancaster, we have the opportunity to intercalate between years 4 and 5 to study at a bachelor's or master's level in a specialised subject. Did you do that, Amina, or know any more insight into that intercalation? No.
I didn't, but I know a lot of people that did.
Yeah.
And I think it is worth looking into if you're interested.
Yeah. It's just, again, that doesn't have to be, that can be at different university. So that's just something to think about if it's a specialist subject you have an interest in.
We can give you the muscles.
And I'm not going to play that video just because I'm aware of time. I just wanted to touch upon, again, we mentioned open days. The days are to be confirmed for next year, but at Lancaster, they're generally in June, July, September and October. Do look around kind of places. We will keep the questions open, but I do know, I think it's Hannah we've got here. So I know I want to pass over and make sure you've got time to kind of give your insights too, but we will stick around to take any questions at the end as well.
Thank you so much. That's been absolutely tremendous to have your insight, I think, Lindsay, into certainly Lancaster and also the medicine application process, but Amina as well, very much with the personal experience, really hands-on at that point in your 5th year. So a real insight. Thank you very much indeed. What we'll do is we'll go directly on to Hannah now, ask her to kind of talk to us about her experience and all the things that she has to share with you, and then we'll come back to Q&A if we may. We might slightly run over, and as long as everybody stays on, we won't stay on too long, but it'd be a real pleasure to get in some of those questions we've had beforehand and any questions that anybody wants to type in the chat. So I'll hand over to Hannah. Thank you very much indeed. Thank you.
Sorry, I'm just getting my slides up, trying to share them. Sorry, for some reason when I'm pressing it, it's not allowing me, it's not taking me further to share my slides.
Right, just bear with us a moment then. Faye, did we have those on email at all?
No, we haven't got
No.
those slides, I'm afraid.
Do you want me to forward them on now?
Yeah, you
Yes,
can
if
do.
you can, that would be great. If you can send those quickly on to Faye and or to careers, we can certainly put those forward now. Thank you, Hannah.
Yeah, no problem.
Whilst
Lovely,
we've
I've just
just
sent it.
That's lovely. Whilst we're just waiting for that, actually, and I know that we've got Lindsay and Amina in the background, but actually some of the things that that you've been speaking about, just whilst we get those up, Lindsay and Amina, perhaps I can just come back to you. You've talked about, we had some questions on the medicine with the foundation year, which you obviously do with the Gateway very specifically, which has been really interesting. We also had a question about A-level chemistry and biology and how important both of those grades are. You have talked a little bit about that, Lindsay, in terms of the entry requirements. Could you just be a little bit more specific again about the chemistry and biology and how important that is? Thank you.
Absolutely. So for the 5-year course, it's 3 years that we ask for. Now, you can have any two of biology, chemistry, or psychology. So if, for example, you were doing biology and psychology, then you wouldn't need the chemistry. So we have a bit of flex in that. However, if you want to do the Gateway year, which is 3 Bs, we do ask for biology and chemistry because it's more kind of down the bio. It's very similar to biochemistry, really, in terms of what that first year would look like. The psychology wouldn't be an option for that. It'd very much be the biology and the chemistry at the 3 Bs level. So certainly it is, we do kind of ask for at least one of them for all courses. If you do both, then great. But if you are doing psychology along with biology or chemistry, that's absolutely fine at Lancaster as well for the 5-year course, and the contextual offers as well.
That's super. Thank you for explaining that again. And of course, it does vary very much at other university medical schools as well. And so it is really important to check out those entry requirements. And also, I think to understand the way in which the teaching is delivered. And one of the things I think that yourself and Amina have really well explained was how Lancaster actually teach students, but it can be very different in those differences between the problem-based learning, I think that Amina talked about, that really suited you. So it's actually really important for students to perhaps visit all of those universities that they're considering and really kind of talk to students about how they are learning, because actually there is quite a difference in how they're taught. I know that. Thank you. Hannah, you've come back online to us, and hopefully we're going to get your presentation up in just a moment. So that's absolutely brilliant. Thank you. Superb. That's lovely. That was with us just for a moment.
Was it up? Oh.
Yes, it was. It was. It just came up so that I could see that.
Has that worked?
Yep, that's perfect. That's lovely. Grand. Thank you. I'll go off camera and Amina, if you want to go off as well. That's lovely. Thank you very much indeed.
No problem.
Thank you.
Sorry for the technical difficulties. Thank you for my introduction earlier. So my name's Hannah. I'm currently a GP trainee. I've just moved on from my clinical education post. And I just thought I'd briefly talk to you today about my journey through medicine so far. And my email's at the bottom there. If anyone does want to email me with any kind of personal questions about applying for medicine or life as a doctor, then please do. So just a bit about me. I was initially studying at Earls High School, and then I did my A-levels at King Ed, so former student and lots of happy memories. After completing my A-levels, I went straight on to study medicine at the University of Birmingham, so stayed quite local. I then, halfway through my medicine degree, I took time out to do an intercalated degree, which was just touched on earlier, which is where you're able to kind of pick a specialist subject and you're able to get a degree in a year. So I got a BMed Sci in psychological medicine, and then I completed the rest of my medicine degree. And then following that, I went on to work as a foundation doctor at Royal Bolton Hospital, so moved up to the Manchester area. I'll touch on what foundation training involves later, because it might be a new term to you. And then after those 2 years, I then took some time out to be a clinical teaching fellow. So I taught medical students for a year, and I'll touch on some of those opportunities as well. And that was a different hospital at Manchester Royal Infirmary. And then as of August this year, I started GP training, and I'm currently working in Salford. So just to give you a bit of an overview. So why should you consider a career in medicine? So most of you will be thinking about this as you start to plan your applications and thinking about whether medicine is the right path for you. Most of you, I hope, are going into medicine because you like to help people. I think it's kind of the classic thing that people say. Obviously, medicine is a completely fulfilling and rewarding degree and career. And I think it's such a privilege to be able to help others. You constantly get to meet new people, be that changes in staff, and also obviously patients. You get different people every day. There's a lot of opportunities within medicine for global travel or global work. In particular, you might hear of a lot of people going to Australia and New Zealand. There's quite a lot of career flexibility as well with regards to what specialty you may choose to go into, or whether or not you prefer academic work or teaching work as well. So it may be that you decide you don't want to be purely patient facing within your career in medicine, due to perhaps trying to get a bit more work-life balance or home commitments. And also it's a very secure job. So I think we can all agree that we'll always need doctors. So hopefully those are some of the reasons. If I can convince you that a career in medicine is a fantastic choice. And also, this was me last year with some of my colleagues. You get to do cool things like see the air ambulance helicopters, which was a really nice opportunity and not something that everyone would get to do. So it's a very cool degree. So just briefly, because I know we've already touched on a lot of this in our previous talk, but just some top tips for applying to medical school. Try and plan early if you can. Revising for A-levels alongside preparing for a medicine application can be challenging. So try and think about how you're going to balance your time, and also making sure that you get that work-life balance in place and keep up with hobbies and things that are important to you as well. You may want to schedule in key dates for your exam, like the UCAT, and also your UCAS applications, as well as open days. And I literally did use a calendar to help me plan all of that. Work experience and volunteering. Different medical schools will have different requirements for how much work experience and volunteering they expect. I did, I think, 2 weeks in hospital placements with regards to my work experience. And I know the King Ed's team were excellent at helping me trying to get some of that work experience. And then also volunteering. So I volunteered with St. John's Ambulance. And that was, it didn't feel like too much of a commitment. And I also found it really interesting. It obviously links quite well to medicine. And I also worked in a charity shop, but lots of people try and get opportunities volunteering in care homes, for example, but sometimes that can be a bit tricky. So just to reassure you, it doesn't always need to be healthcare related. Like I said, I worked in the charity shop as well. So scholarship opportunities. So again, just touched on previously with widening access schemes. I went to Birmingham on a widening access scheme called A to B. I'm pretty sure we had a talk about it at King Ed's as well. I'm not sure if that still happens. But with that, it meant that because I came from a widening access background, that I was able to apply with reduced entry requirements. And at Birmingham in particular, if you get the standard entry requirements, which I think was A star AA, then you were able to get a scholarship to help fund some of your time at university, and you'd get that each year, which was a real help financially during my time at university. So just make sure you're doing your research and see if you're able to apply for those if you meet the criteria, because it can be really useful. I've just put a point on reflection here. Reflection is key throughout medical school and as a doctor. So you're trying to think about, rather than describing an experience, but what you've learned from it and what you might do differently next time. And I'd say if you can kind of come across that you're reflecting on experiences you've had, even in your medicine applications and during your interviews, that's really like fantastic, and some of the skills that they'll be looking for. And then we've already touched on the entrance exam, so I'm going to move on from that. Just some useful resources. Again, I'm happy for these slides to be sent out. But these are some of the things that I'd recommend. So the Medical Schools Council has a lot of information about the different medical schools, different entry requirements. So if you're not sure where to begin, I'd say that's a really great resource. Medic Mentor is a scheme that I've been working with in the past. And it's free to use, and they put on a lot of conferences or workshops to help you prepare for your medicine application. They've got lots of mentorship opportunities on there as well, so you can have mentors with doctors or current med students, and that's a really fantastic resource. So very briefly, as I know we've kind of touched on this, but life as a medical student, at least in Birmingham, the first 2 years were quite preclinical. It was more of a traditional teaching rather than the problem-based learning. So we had a lot more lectures. It was quite lecture heavy. We still had small group teaching, again, about 20, 25 students, where we'd discuss clinical problems, often with a tutor to help guide us. And then we also had quite a lot of anatomy teaching. At Birmingham, we had pro sections, so we had real bodies, but they'd already been dissected and labelled, so we could see, or for example, the muscles, nerves, and blood vessels of real life bodies, alongside some of the virtual techniques, like we had the anatomage tables as well, which are really useful. So moving on to the clinical years, which tend to be from the end of year 2 onwards. This is where you really feel like you're becoming a doctor. You get to learn how to take histories from your patients and really build on those communication skills that you may have had a bit of teaching on in your preclinical years. You learn a lot more about how to prescribe medications, and you'll have a prescribing exam at the end of your final year. You'll have a variety of placements at different hospitals, and you try and go through a lot of the specialties. So that could be like paediatrics and child health, to colorectal surgery, to ophthalmology. So it really gives you a taste of all the different specialties that are available to you as you progress and then graduate. You also learn a lot more clinical skills, so you get to take bloods from patients, give injections, things like putting in catheters, which is a thin flexible tube into someone's bladder to help collect their urine. So it's really a lot more hands-on. You'll get time in operating theatres, and often some surgeons will let you assist in that, such as holding different pieces of equipment, which is a really fantastic opportunity. And again, links in with all your preclinical knowledge. And then, of course, you also build on your examination skills and how you detect something that's abnormal from normal within the human body. So what happens once you graduate? This is a bit of a busy diagram, but I just want you to focus on the length of time, really. So your medical school journey is just the beginning, tends to vary in length depending on whether or not you intercalate or you do, for example, a graduate entry scheme. So in graduate entry, you may do a degree such as biochemistry or science-related degree, and then you may decide that you want to then go on to do medicine, which increases your time obviously within university, but instead of it being a traditional 5-year course, it tends to be a 4-year course for your graduate entry medicine, and that's another route in if you don't get into medicine first time, for example. Then you go on to do your foundation programme, which is what I was saying before. So this is a 2-year mandatory programme that you do post-graduation if you want to continue to be a doctor, and this is across the whole of the United Kingdom. And you apply for that, and then you tend to do 6 rotations, which I'll touch on shortly. And then at that point, you have to decide what you want to specialise in, and the length of the specialist training really depends on what you want to do. So, for example, I'm doing GP training, which is only 3 years, whereas some of them on here, for example, if you wanted to go into surgery, tends to be up to a further 8 years of studying. So it can be quite an intense career with a lot of studying and exams, but again, incredibly rewarding and fulfilling. And you can take breaks to do different things as and when you need. And obviously, you don't have to be part-time. There's flexibility with part-time working too. So that's just to give you a bit of an overview. So just a bit about my life as a doctor. My foundation training was quite varied. I really enjoyed it, and it was great to really apply what I've learned at medical school. So during my FY1 years, that's my first year post qualification, I started off on a complex care ward. So I had my first night shifts, which was my third day, I think, post being a doctor, which was quite scary, but all went smoothly. I had a lot of support from my senior team and colleagues, as well as other healthcare professionals working. So we had specialist nurses on the night shifts, for example, who were able to support you when you're particularly junior. I then went on to have a colorectal surgery replacement, so I got a bit of theatre time within that, but mostly ward-based because of you aren't trained up really to be doing the operations at that stage. That would require a lot more training. That was a really nice job. You got to interact with quite a lot of your other FY1 colleagues, which was nice to build quite a community, and I felt it was quite a social job. My last rotation was A&E, which had quite a varied shift patterns, quite a few night shifts and odd working hours, finishing at 11 a.m. or 2 a.m. So you've kind of got to be quite flexible around your shift patterns in medicine, I would say, at least in the first 2 years. But again, that was really good. I got to see patients at the front door, so be the first doctor who assesses them, which was a really great experience and helped build my confidence quite a lot. Moving on to my second year, my first placement was in general practice. So at that point, I actually had my own clinicalist where I was seeing my own patients. I got to go to home visits, so going into the patient's own house to assess them there, particularly for the elderly and frail patients. That can be really valuable, and you learn a lot more about a patient's lifestyle by going in their own homes as well. So that's what kind of clinched it for me going into general practice as my training. I then had a palliative care rotation, which is care of people who are approaching the end of their life. That was quite, I'd say, my most rewarding placement of medicine so far. So that was a 4-month stretch, and I got to do community work and hospital work. And I think you can all imagine it can be quite an emotionally difficult, challenging setting, but actually it was very life affirming and incredibly rewarding. And then my last placement was obs and gynaes, that's caring for pregnant women as well as women's health. So that would include helping to deliver babies. So I went into theatres, helped with C-sections, which was such an incredible experience, as well as helping with clinics and seeing people coming in with emergencies as well. So you can see your foundation training post qualifying, you still got plenty of opportunities for training and support and learning, but it tends to be very varied still. And those 2 years help you to try and figure out what you may want to specialise in. So gives you lots of opportunities there. So just recently I thought I'd do a day in the life of, so I'm currently working on the emergency assessment unit as part of my GP training. So I'm back in the hospital. This is when patients have come in from A&E and now they've been just first admitted to hospital. So I thought this would be quite useful so you can see what you actually do as a doctor. So at 9 o'clock in the morning, I attended handover, which is where the night team hand over their jobs or poorly patients to the new team coming in. And we also get assigned a bleep. And this is kind of like a little device that you hold and it physically bleeps at you. For example, if there's a cardiac arrest, and then we know where to go. And it gives you a little acknowledgement that you need to go see someone who's poorly. Then I went back to my normal ward after handover to do the daily reviews of patients on the ward. That's normally with a consultant who's the most senior doctor. We had a quick coffee break because we had quite a few patients to see, and then we cracked on. So after that, you need to think about creating a jobs list. So that's where you go through all your ward round entries and you think about what you need to do. So some of the standard jobs you might be doing as a doctor might be making referrals to other teams. It might be updating relatives. It might be taking blood. or it might be assessing more unwell patients later in the day and things like that, and prescribing tasks. So again, really varied. Then I had a quick lunch break, because it's really important that even on your busiest of days, you still make sure that you're looking after yourself, having a good lunch break and a bit of time to decompress. Then you're working through the jobs on the ward, so that takes normally a good kind of 3-4 hours of your afternoon. Again, similar things that I mentioned earlier, so working through your jobs list. Then at 4:30 you attend another handover, so that those doctors who are staying or those who are leaving get handed over about the sick patients. At this point during my day in question, I had the cardiac arrest bleep go off. So that's when a patient's heart has stopped. So normally about 5 or 6 doctors run to the ward where it happens. So this could be anywhere in your hospital. And then you'd start resuscitation to try and help that patient come back. Again, working with a lot of your colleagues in these scenarios, teamwork's essential. So a lot of the nurse and staff and healthcare assistants are there helping during those scenarios. And again, they're really rewarding and fulfilling careers that I would also recommend you looking into if you're considering medicine. And then after that happened, that took probably about an hour of our shift. You then get bleeps, so that's either again through that little device, or at my hospital we have online bleep system as well, so jobs are sent virtually to us that we have to crack on with, and again very similar to the ones I mentioned earlier, but it tends to be more patient reviews post your standard working hours, which tends to be around 4:35 p.m. With limited doctors on the ward, so it can be quite busy. And then lastly, I finish my day at 9 o'clock. Where we do those handovers again. So quite varied days, and you can see it's quite a long shift. This was an example of an on-call shift, which tends to be 12 to 12 and a half hours. So again, it's just thinking about whether or not you'd be happy with having those sorts of shift patterns going forwards. And again, it doesn't always have to last forever. And I've obviously picked GPs in my day, shouldn't kind of be as long as this, hopefully, but just to be aware this is what will be expected of you, so certainly when you start your training. So just briefly, because of time, I just want to discuss FY3 years. So this is a relatively new term that we have, where after your foundation training is complete, you go and pick maybe something outside of your specialism training. So I chose that to teach, as I really like teaching. So I just took 1 year out of training to be an educator, and that provided me with lots of opportunities, and I'd really recommend you guys thinking about this if you go down medicine. So I was able to present at conferences and present some research that I helped design. We have medical simulation training that I designed and helped to run these sessions, new teaching workshops and influencing the medical school curriculum. And then also thinking about obviously teaching our medical students your examination skills. And I also got an additional qualification during that year for a postgraduate certificate in medical education. So it's just to show you that how varied a career medicine can be and how many opportunities that there are out there for you. So thank you so much for listening. I'm happy to take any questions.
Thank you so much, Hannah. That's absolutely excellent. It's really, really great to get that sort of experience post-training, but you never stop training by the looks of it. And each experience, obviously, in very different situations, builds on you know, those experiences that perhaps somebody like Amina is having at the moment. Really interesting. Thank you. I'm sure there will be some questions that will come up in the chat, but one of the things that would be really interesting, and I know it's a little bit further back for you, Hannah, but thinking about the students who are online at the moment, probably mostly in year 12, and obviously coming into really the end of towards the end of their first term, but they're all considering work experience and the kind of things that they can do in addition to their studies. Is there anything that you could talk about that would stand them in good stead? We know we always talk to them about work experience and how important it is, but perhaps some of those other skills and how they might gain those, that would be really, really helpful, just to sort of think back to those times and what might be helpful for year 12s.
Yeah, so I think when I was doing my work experience, I came to yourselves at King's to help me organise it. So I had a placement in midwifery. So actually, I was working more with midwives than doctors, but that was very applicable still to the medicine application. And obviously, you learn a lot from working with different colleagues and in teams. There's also, since COVID happened, it became a bit more challenging during that period for people to get work experience. So there is a virtual work experience scheme that is available now. I think it's with Brighton and Sussex Medical School, but it was on my slides again, which you can work through. And I think a fair few universities will accept that as well. I would say if you can get in face-to-face a clinical experience in work experience is probably best, just to make sure you can kind of figure out if you think it's for you with the environment that you are working in. But really just trying to reach out to as many people as you can. So your local hospital, for example, or GP practices, if you can get a contact, even going into the reception team and just asking if there's any work experience opportunities that you can get. Obviously, it's difficult around your studies, so I did mine in like the half-term breaks, just to try and balance that. And if you can do a bit over the summer holidays as well, that's probably going to be your best time. But I know it is difficult to get the balance right when you're trying to study as well for your A levels.
It is, but thank you, Hannah. That's really helpful. And we have a work experience program, which Jane, who's online, also is kind of administrating. And we have an MDV, a medicine, dentistry and veterinary group with Aspire, where all students who are intending to be medics will want to register around December time, when they're asked the question, are they interested in applying for medicine, dentistry or veterinary? And the Aspire team will take them through some of the recommendations for the online, certainly with Brighton, but also some of the other work experience programs that are offered virtually. And I think as well, it's really important to add into that the importance of perhaps some volunteering and gaining some of those skills, not just in a clinical setting, but certainly within a range of environments where those softer skills are developed. And I think that's really, very useful. Amina, I wonder if I can come to you for a moment and just ask you as well, if you could just talk students through perhaps a little bit of that initial application process, and what you might, if you think back now, what would you add into their experience in year 12 that you might have thought about, and that might be relevant to them now?
Yeah, I think obviously thinking about work experience as early as you can is always a really good start. You don't want to leave it too late, and also trying to get somewhere where you can show a bit of time commitment as well. So obviously this doesn't have to be clinical settings, like you said. It can be very much volunteering. So if you do like volunteering once every fortnight at a hospice or a charity shop or things like that over like year 12 or year 13 alone, that could show a lot of skills when you're doing personal statements and things like that. And talking about that in your interviews would be really useful as well. So it doesn't need to be clinical only. I think my main advice would be thinking about other things as well, and trying to get into something more long term as early as you can. If you can't, it's completely fine as well. It's not something that you have to do, but I would definitely recommend thinking about that. Also, I guess reading up on how the healthcare system works as early as possible as well, because a lot of your interview stations, they might test you on your knowledge of certain current affairs in the NHS and things like that. So getting a better understanding of how the NHS works, just by reading up articles, keeping up to date with medical news and things like that, just so you're pretty aware of what's going on in the medical field. That'll be really, really useful as well. And I think instead of leaving that just before your interviews, building that up over time is really helpful. My sixth form used to make us sort of keep a portfolio of really interesting medical news and things like that, different cases, so ethical things and things like that. So just so you have a lot of things to talk about when you do come to that interview point. So that would be my two main points, I'd say.
That's really, really helpful. And I think keeping the portfolio is a great idea, actually. And I would encourage all students to do that, especially if their own research, their own readings, any cases, as you suggested, and any experiences that they have to note them. There's a very specific question for Lindsay about the third A level being psychology. And I wonder, Lindsay, if you could just reiterate a little bit about the psychology for us, just to clarify, if that's helpful. Thank you.
No problem. Yeah, I was just answering that actually. Yeah.
Right, thank you.
So it's 2 of 3. So your 3 options for the main program are biology, chemistry, and psychology. If you were studying biology and chemistry, it doesn't matter what the third A level is. It doesn't have to be psychology. That's just another option. So you could study biology and psychology plus a third A level. But if you're doing biology and chemistry, it doesn't matter what the third A level is. It can be in anything.
That's super. Thank you very much indeed. And Jane's been putting in there that work experience at Russell's Hall Hospital will be advertised just around Christmas time. And also there are a few questions that came in earlier, and I'm very aware of the time, but just to say that Faye has put some information in there about the degree apprenticeship, and there's actually quite a lot of chat about the level 7 degree apprenticeship for medicine. I would suggest that actually that's worth reading rather than us reiterating at the moment. It is a trial, it's a pilot at the moment, and I think it's very important to understand it in context of leaving school and being going on to a degree apprenticeship for medicine has a lot of additional information you need to read up first, and I do suggest that anybody who's interested in that does actually look at that link. There was also some information there that Faye has put in about the situational judgment test, and there's some information there about how it's used in the link, so I won't reiterate that. Just thinking about our students in particular at King Ed's, the MDV group through Aspire will also pick up support for the UCAT, and there'll be sessions on that. And I think it's really important that students just make sure that they're known to staff through December into January time that they are intending to seriously consider medicine. I think we would very much indeed like to thank Hannah, Lindsay, and Amina, and draw things to a close. There are lots of things that Jane and Faye have been putting in the chat there, but just to explain as well that through the medicine pathway we will continue to support students as well as the MDV group and healthcare students in looking at the other additional professions in the healthcare system. We would encourage all students to be reading the NHS values. I think, as Hannah suggested, understanding the sort of the clinical and the sort of more pastoral side of delivering medicine in the community. So those volunteering things that Amina talked about, maybe looking at a care home, something like that as well, and working with young children or elderly people in some way in the community is always helpful. Lots and lots of information to send out to you, lots of links and the presentations from this evening. I'm going to wrap it up there because we're already an hour and a quarter in, and I know we could go on talking for a long time. We so appreciate you sharing your experiences and the information that you've given to us, and I hope all 3 of you will be willing, perhaps if students have separate questions, they can forward those, as Faye's put there, to careers@keds.ac.uk, and we can forward them on to our 3 experts this evening. Thank you so much for joining us. We're really delighted to have had you here. Lovely to see our alumni Hannah as well, and we look forward to welcoming you all back, we hope, for another talk in the future. So thank you. Been a whistle-stop tour, and we will ask for the recording to be sent round afterwards. Thank you all for this evening. We look forward to seeing you all again. Thank you. Good night.
Thanks,
Thank
everyone.
you.
Bye.
Good luck, everyone.
Thank you. Good night.